All right, well, thank you guys for joining us again for another Health Truth Life video. We're going to be going over another one of our matrix, Health Truth Life matrix concepts. Going over concept number 5 over here, which be
Jason.
Meds and supplications. What?
Jason.
What'd I do?
What number is it this week?
6. I was off by 1. Sorry, number 6. We're not going to go back over food and hydration.
Did you say supplications?
Did I? Let's start over. Rewind. I probably did. All right, go back.
All right, wait. Let's start again.
You don't want to stop it? You don't want to use that, don't you?
No. Huh?
Right.
You usually lean back while you do this.
You're leaning forward.
But I lean forward, then I lean back.
Okay. You have a routine? I don't even think about it.
I do. Do the horse thing.
You're putting that in there, I know. It's coming.
Okay. Oh, this is good. It's good. Good.
Try to keep it? Okay.
Yeah, it'd be good. Be good. All right. Give me a second. All right.
All right. Thank you guys for joining us again for another Health Truth Life video. Today we're going to be going over another one of our Health Truth Life matrix concepts.
Yep.
We're going over number 6 today, which would be meds and supplements. Yeah, another one where there's a lot there. It's a pretty heavy thing to discuss and go over. I'm just going to read the first quote here from our concept sheet, and it says, "Medications are a blessing and can aid health in many ways, but can we get to the root cause of chronic illness and lower our dependence on medications and reduce potential side effects?" So medications are great. They are a blessing for sure. I personally had them help in a lot of ways. But at the same time, if we can get to the root cause of what's causing our symptoms or pain, whatever it is, and we can take care of that without medications, because medications cause other issues and side effects. They can. It's obviously probably a better way to go. So let's talk about, supplements and other things that we can do. Meds and supplements.
Yeah.
How can we take those together?
So kind of what this brings up again is that the 3 questions that we brought out in the initial part of the matrix, when we introduced the matrix. What am I putting in my mouth? Because one of the ideas with this was, hey, don't put medications and supplements, simply put nutrients, vitamins, minerals, that which you can get from food or from supplementation. Now, this brings back to that what I want to point out with this is that regardless of the nutrients and the vitamins and the minerals, what people are putting in their mouth is medications and sometimes supplements.
Hippocrates he has a quote about how food is medicine.
Exactly.
So,
Exactly. So this is, of course, the second part of the intake, which, of course, we talked about last week, food and hydration. This would be medications and supplements, which a great majority of the population takes medications and or supplements. We want to talk about that because that's what we do recognize that. Yeah,
for sure.
So
to kind of simplify it, you talk about in here too, like there are certain medications, if we get a headache, if you're struggling with some pain and inflammation, like it's easy to go grab some Advil, Tylenol, ibuprofen, whatever it is. And that's great. Like we have access to those and we can use them. And for the most part, there's, a little bit of negative effects, but not too bad with a lot of those. But yeah, just seeing that it is a blessing. It is a gift.
Absolutely.
But then too, talk a little bit about food-wise and other things that we're consuming and putting in our mouths that can help with this as well. So we can depend less on these medications.
Yep, which brings up again, like with the example of headache, or even in this matrix concept sheet that I talk about, blood pressure.
Yeah.
What is the root cause of these things that requires the need to take that medication?
Yeah.
And then how can we potentially change lifestyle in working in concert with the patient to then maybe lower their need or dependence on that medication? And are there foods? Are there lifestyle changes?
Yeah.
Are there lifestyle activities? Is there weight loss? All these things that can play into maybe needing less of that medication. So, for example, with the headaches, we treat a lot of headache patients with higher doses of magnesium and even doses of vitamin Bs.
Yeah.
Do they fix everybody? No, because there could be a food sensitivity. There could be a vascular issue with that person. They could have something else going on that's causing headache, which could be tension, stress, upper neck strain, things like that, where physical therapy or chiropractic or someone of that training can help out. So, again, a lot of things, what my desire with a lot of this matrix, as we know, is to get back to kind of root cause. What's causing your ailment, and how can we navigate your medications and supplements to balance out and give you exactly what you need, no more, no less.
Yeah. I mean, finding the most natural way to help with these symptoms, what's causing your issues. Obviously, if you can find a natural way to do it, that's the best way to do it.
We had a great discussion this morning. I want to interrupt you and I apologize, but because this is a point of like, hey, when you get back to like complete and utter truth, what do I need to be vitally healthy? And you mentioned, if I have a really optimum diet,
do we really need supplements? Why do we depend so much on supplements?
Great point. And what was my example?
Can't recall. Tell me.
Wisconsin.
Oh yeah, Wisconsin. That's true. Yeah.
So think about what did I mention?
So basically, in Wisconsin, in the colder months in wintertime, they're not getting a lot of sun. They're not getting a lot of.
So they're not getting
vitamin D.
Vitamin D, exactly.
Yeah. So that's a good example of they can't go outside and naturally get it. So then they do have to supplement.
It would be optimal for them to supplement during that time. So that's an example of, hey, a person in Wisconsin or in Canada or what have you could be doing as well as they can to try and optimize and get enough vitamin D, either nutritionally or sunlight wise. But if they're only getting a few hours of sunlight a day, they're not going to have an optimum vitamin D.
Not like
level.
us here in the sunshine state of Florida.
Which even here we have patients with low vitamin D. You know, so
people don't want to get outdoors.
They don't. So, but so it's that's kind of my desire with this is, hey, get back to root cause and how can you find out what you need and no more than that. You know, and limit what you're dependent on.
I mean, I've got some personal examples too with going through back pain. Suffering from back pain for years and years and years, and having to go through pain management and having to get on opioids. And there's pros and cons to those. Like, for sure, it helped me during that time, but overall, I was not healthier. I was not doing better. So I wanted to do everything I could to get off of those. And then it's interesting, one thing I was thinking about too, so I was able to get off opioids and look for more natural ways, to take care of my back pain. And through physical therapy was a big part of it. And then a modality that we have here that I was just thinking about, man, the laser therapy has been a blessing for helping with inflammation and then pain reduction. I was just thinking about this. I take a lot less ibuprofen now, because of that. And so it's a blessing. There are those natural things that we can do that, where we don't have to depend on certain medications just to kind of like hide and mask pain and feelings and symptoms, because they're not healing anything. They're just masking and, helping us get through our days. But if you can find natural remedies and other things where there's going to be some healing and will help you, encourage you to get out and be more active and get to where you can stretch more and do more natural things, then there's more benefit in that for sure than just taking medications to mask it.
Absolutely. In this discussion also we talked about some supplements that some people may consider taking that may be beneficial to their overall health. And some of the things that we do see people taking more of would be things like vitamin C, vitamin D3 with K2. K2 allows for better absorption of the vitamin D3 and helps prevent calcium from going where it shouldn't go or where you don't want it to go at higher amounts, which would be kidneys, blood vessels, heart vessels, etc. Other things would include some degree of zinc if you're not getting enough zinc in your diet, especially during cold and flu season. A multivitamin that has certain nutrients and minerals that you may be not getting enough of with your diet. Of course, those who are very clean eating and eating enough high quality protein, carbs, and fat with enough micronutrients, they may need less or no multivitamin. But we have a number of patients with an MTHFR defect, that's a methyl tetrahydrofolate reductase genetic anomaly, which is very common in patients or very common individuals, which increases their need for activated vitamin Bs and methylfolate, which is the active folate, which is not the same as folic acid, which is put in a lot of fortified grains and in most cheap multivitamins. So folic acid in those patients with MTHFR genetic anomalies or mutations, it actually can be harmful because it causes and is associated with an increase in homocysteine. So that's one of the caveats with respect to, hey, why would I want to be on a supplementation if my diet's clean? Well, first of all, I bet your diet's not completely clean and you're not completely dialed in, because I know I'm not. And most of my, I've got a couple patients that are probably super, super clean and intentional in everything they eat. And even them, they're not optimized. One of them actually has a double MTHFR genetic thing, and he still does take some supplements from time to time because it does give him the type of folate and B vitamins that benefit him because of the genetics that he's got. So these are just kind of some reasonings why you'd maybe want to be on a multivitamin despite a decently clean diet.
So I call a few more that you talk about here are the omega-3 fatty acids, the fish oil, magnesium. That's another big one that we recommend to a lot of patients, and then zinc and probiotics.
And of course, omega-3 fatty acids, somewhat controversial. There was an article that came out not too long ago that mentioned that there was no benefit in omega-3 fatty acids with a certain outcome, and I apologize, I forgot which outcome that is, and I don't want to misstate it. But the point is, man, there's a lot of nuance with respect to nutrient and or vitamin literature. And what I would say is I don't recommend omega-3 fatty acids on every patient, but there's a time and a place where I do. And I would say for anti-inflammatory components, inflammation, certainly beneficial. We've used it with some patients with longer haul symptoms with infections for what's going around as well. And there's some anecdotal evidence to show that it's beneficial with that. Also with pain syndromes, for sure there is a not only experimental and or laboratory / research evidence of anti-inflammatory component of omega-3 fatty acids, but many patients agree that higher doses of omega-3 can be beneficial in lowering pain. But it's one of those things where it's another tool in a tool shed of supplementation.
I mean, just to show you, so going through what we've gone through the last couple years, 2 or 3 years with COVID, and we're coming up on flu season again. Talk a little bit just how important and vital it is. Diet, we can talk about diet, obviously that's a big thing, but then too, supplementation going through this season. This is a time of year where it's
Jason, I'm surprised that there's still so much kickback on people talking about nutrients and or supplementation with respect to immune activation, because there's so much data out there to support.
It seems like that's common sense now.
It does. And some of the things that we recommend, obviously, for cold and flu season is optimizing your vitamin D, checking your vitamin D level to make sure it's in an optimum range, right? That's number one. Number two, eating a more nutrient-dense diet, but also avoiding simple carbs, simple sugar, lots of sugar, things like that are not helpful. And so other things are certainly evidence to show that vitamin A supplementation in an optimized dosing can be beneficial with immune function. Echinacea, there's some evidence of supporting or showing support of that, not typically as a preventive, but during first signs of illness, echinacea can be very beneficial. Elderberry can be beneficial, and many people will take that more on a preventive basis because there is that does seem to be okay to take over longer periods of time. Of course, that's your physician and provider. But there's so many things and so many tools out there to immune activation and or during first signs of illness that we utilize and many physicians do as a supplement or a higher dose supplementation during acute times of illness, and we've used it for many years with very good success with what's taken place over the past few years. So point is, do your research and find physicians and practitioners that are, you know, actively engaged in empowering you with this information.
Yeah, I like that. That's kind of what you put towards the end of this concept sheet here is be empowered, recognize the power of your choices, explore ways in which you may reduce or eliminate your need for medications by getting to the root cause of the problem. And then you even say here, be patient, because it can take a little bit of while to, you know, a little while to get this for the supplements to kick in. But yeah, do you want to expand on that a little bit?
Or the being patient?
Yeah, just that overall, like the being empowered and recognize the power of your choices.
Yeah, well, I'd also say recognize the power that, hey, if I'm taking, when I have someone that comes in with a bag of supplements, I'm like also going, okay, wait a second. Or they're taking a bunch of stuff and they don't tell me the other 3 or 4 things they're taking that could be causing an issue. Yeah, I mentioned that patient that we had the other day that gave me a list of supplements, and all of a sudden as we're walking through the history and physical, she goes, oh, by the way, I'm taking this too. And I was like, okay, well, let me check and research that. Because the point is, everything we put in our mouth can have a positive benefit or a negative benefit. And that's something that you want to recognize and take account of everything you're taking, medication, herb, supplement-wise, you know, because they all can have positive but also negative effects. Yeah. So...
you know, you wrapped it up here and said, you know, what a blessing to have modern medicine. You know, medicine is a gift; it's a blessing. So, you know, we're not saying don't take medications at all. They have their place, and there's value there. Get to the root cause, and then obviously, ideally, if you can find natural ways to help with your symptoms and your issues, then that's the best route to go. But we know and recognize medications are a blessing.
No question.
And then, what is the root cause or your state of dis-ease? So, and then how can you enhance your overall nutritional status with food and with supplements?
Absolutely. You know? That's something that we talked about last week with the food and hydration matrix concept. So, as always, we appreciate y'all listening. Down below in the description will be a link to matrix concept number 6. That's medications and supplements. Would love for y'all to have a free download for that. We appreciate y'all listening. Would love for you to like and subscribe this video. Certainly helps the channel kind of grow. And also, we will be here next week with another video, plus matrix concept number 7. That would be environment. The environment we're exposed to, the environment we put ourselves into, and how it plays a role in our overall state of health or disease. So.
Should be another good one. Looking
good
forward
stuff.
to it.
Thank you guys very much. We appreciate it. Have a great weekend.
Thank you.